Hi guys, so this is a third part of the renal pathology video, and today we are gonna discuss about the post-streptococcal glomerulonephritis. So post-streptococcal glomerulonephritis, it is also called as acute proliferative glomerulonephritis. It is one of the cause or one of the example of nephritic syndrome. So pathogenesis, it follows a streptococcal infection rather than a primary infection of kidney by streptococci. So it is a secondary infection followed by a primary streptococcal infection. And this primary streptococcal infection usually involves pharynx or skin. So if it involves pharynx, it causes pharyngitis. If it involves skin, it causes impetigo or pyoderma. And it is associated, the skin infection is always associated with overcrowding or poor hygiene. So only certain strains of group A beta hemolytic streptococci is nephrogenic, that is types 12, 4 and 1, identified by typing of M protein. So of the streptococcal cell wall, the M protein is present in the streptococcal cell wall. So the primary streptococcal infection is caused by group A beta hemolytic streptococcus. Is that fine? Yes, so the main streptococcal antigenic component, that is streptococcal pyogenic exotoxin B or streptococcal glyceraldehyde 3-phosphate dehydrogenase. So these are the main antigenic component of this streptococcal infection. So latent period is 1 to 4 weeks following the primary streptococcal infection. So it is always immunologically mediated. So what are the mechanisms of damage? So mechanism. Antibodies are produced against the antigen, that is streptococcal antigens. So the body produces, after a primary streptococcal infection, the body produces antibodies against the streptococcal antigen, that is M proteins. So antigen antibody complexes are formed in the circulation, which gets trapped in the glomeruli. So what happens? It activates the complement and also recruit leukocytes, which in turn activates the other humoral and cellular mediators of inflammation. So binding of the immune complexes to the Fc receptors of leukocyte occurs. So there are antigen antibody complexes. This is also called as immune complexes. It binds to the Fc receptors of the leukocytes. So it activates the cell injury. Okay. So this stimulates the proliferation of mesenchymal and epithelial cells, leading to the hypercellular glomeruli. So what is the mechanism? Antigen antibody complexes are formed because antibodies are produced against the streptococcal antigen. So antigen antibody complexes are formed. It gets trapped within the glomeruli, and then what happens? It stimulates the complement system, and what happens? This causes the cell injury and inflammation, and thus causing hypercellularity of the glomeruli or proliferation of the mesenchymal and epithelial cells. So this is the basic idea of pathology. Deposition of circulating immune complexes, that is antigen antibody complexes are formed. It may get deposited in the subepithelial region. This is the glomerular basement membrane, this is the epithelial side, and this is the endothelial side. So it may get deposited in the subepithelial side, that is at outer surface of the glomerular basement membrane. So this is the glomerular basement membrane. Antigen antibody complexes or immune complexes may get deposited outside the surface of the glomerular basement membrane. So, and it may also get deposited within the mesenterium, and it also gets deposited in the subendothelial region, that is inner surface of the glomerular basement membrane. This is the glomerular basement membrane, and it may get deposited within the inner surface of the glomerular basement membrane, and all these will lead to the granular immunofluorescence. So these are the morphology. Talking about gross morphology, kidneys are enlarged. The kidneys are enlarged, and we will have a pale capsular surface and cortex. Coming to the microscopy, this glomeruli, what happens to glomeruli? Enlarged hypercellular glomerulus can be seen. So why enlargement of glomeruli occurs? This is due to the infiltration of leukocytes and also the proliferation of endothelial and mesenchymal cells, and rarely the proliferation of podocytes, which forms crescent, and if it forms crescent, it will be having a poor prognosis. So why glomeruli is enlarged? It is, first of all, it is due to the infiltration of leukocyte as a response to the cell injury or complement activation, and second, it is due to the proliferation of endothelial, mesenchymal as well as podocytes Okay, so this is the classical diagnostic feature in glomerulonephritis. There is post-streptococcal glomerulonephritis, and it is also diffuse, that is, it involves all the glomeruli. So then the next feature involving the glomeruli is the obliteration of the glomerular capillary lumen. This is also due to the infiltration of leukocytes and also the proliferation and swelling of the endothelial and mesenchymal cells. And what happens to the tubules? Tubules, the red cell cast in the lumen can be seen. The tubular epithelial cells may show degenerative changes. What about the interstitium? Edema and inflammatory cell infiltrate. So blood vessels, the unremarkable. So these are the morphological features. About growths, that is, the kidneys are enlarged and pale capsular and cortex are seen. And about the microscopy, we have four changes in the glomeruli and also tubules, interstitium as well as blood vessels. So we are talking about the electron microscopic findings. The subepithelial deposits of the amorphous electron dense deposits. That is, what are the electron dense deposits? That is, immune complexes are the electron dense deposit. These are the characteristic features. Okay, electron dense deposits along the subepithelial region. And it appears as dome-shaped humps. It is also called as humpy, lumpy deposits, and it corresponds to the granular IgG and C3 demonstrated by immunofluorescence. Subendothelial, intramembranous, and mesenchymal deposits can also be seen. That is all about microscopic findings. Electron microscopy findings. So then we are talking about immunofluorescence microscopy, granular deposits of IgG, IgM as well as C3 in the mesenchyme and along the glomerular basement membrane. It causes granular fluorescence. Okay, in electron microscopy we will see humpy lumpy deposits. In immunofluorescence we will see granular fluorescence. So this is the electron microscopic findings. That is subepithelial immune complex deposition. So this is the basement membrane and this is the visceral epithelial cells. Okay, and this is the endothelial cells. So immune deposition is around, immunocomplex deposition is along the subepithelial basement membrane, subepithelial side of the basement membrane. And the second feature is endothelial cell proliferation and swelling. These are the endothelial cells. So endothelial cells proliferation can be seen under electron microscopy. And this is the infiltration. This is the mesenchymal. This is the mesenchyme and mesenchymal cells. So there are few neutrophils, monocytes, etc. Due to the cell injury. And the other feature is proliferation of the mesenchymal cells. So that is all about the electron microscopic findings. And we have the light microscopic findings. So this is the visceral epithelial cells. Okay, so these are the visceral epithelial cells and this is the glomeruli. Okay, and this is the Bowman space. And we have the proliferation of mesenchymal cells. So these are the mesenchymal cells. We will see many proliferated mesenchymal cells here. And also obliteration of the capillary lumen. These are the capillary lumens and these are the endothelial cells. So we'll see obliteration of capillary lumen and hypercellular glomeruli. So these is the hypercellular glomeruli, infiltration of neutrophils and monocytes. So these are the infiltrated neutrophils and monocytes. And endothelial cells are proliferated and swelling occurs. These are the endothelial cells which gets proliferated. So that is the light microscopic findings over here. That is all about post-streptococcal glomerulonephritis.